Medicare, federal program, individual insurance. There's no group feature to Medicare. Medicare covers the individual, and as it was originally designed is for people 65 years old and above. And that is one thing to remember, is Medicare is still 65. You can retire at 62. You can put it off till 67. The subject of Medicare needs to be dealt with to the age-based beneficiary at age 65. Even if you're going to work past 65 and have employer coverage, you still need to be in contact with the Social Security Administration to make a decision about Medicare. Now, there are more people on Medicare now than there were originally. We still have the 65-year-old and above, but we also have anybody that is declared disabled by the Social Security Administration after 24 months of drawing Social Security disability benefits becomes automatically eligible for Medicare. Also, people with certain diseases, ALS, Lou Gehrig's disease, or end-stage renal failure, kidney disease, those folks automatically are qualified for Medicare. But the majority of folks we deal with are either 65-year-old qualifications or through the disability program. How do you join Medicare? Well, if you're disabled or with the diseases, it's automatic. It's a little different if you're 65. There's various options. If you are on Social Security retirement benefits before age 65, you automatically are enrolled in Medicare at age 65. However, if you are not drawing Social Security retirement benefits, you actually need to contact the Social Security Administration to enroll in Medicare. And you have a 7-month window in which you can do this. It's the 3 months before the month of your 65th birthday, and Medicare always begins on the first day of the month, and it begins on the first day of your birthday month unless your birthday happens to fall on the first day of the month, in which case it begins the first day of the preceding month. Why that is, I've had explained to me. Other than it being a good test question, I'm really not sure why, but that's the way it is. But again, you have a 7-month window to join, the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and the 3 months following the month of your 65th birthday. When you apply determines when your Medicare starts. If you apply in the 3 months before your 65th birthday, Medicare starts the first day of the month of your birthday. If you apply the month of your 65th birthday, it begins the first day of the following month. If you apply in the month following the month of your 65th birthday, it is delayed till the second month following. If you wait until the second or third month, it is delayed by 3 months. Why? There is a reason. There is logic to this. People decide, well, I'm eligible for Medicare. I have to pay for some of it. I'm not going to use any services for a month or two, so I'll just delay it. Well, that's not the point. You need to take it when you're eligible, and by delaying this, they keep people from easily being able to say, well, I'll wait a month, and then if I need it, I'll start it. They delay it. If you happen to miss this initial period, and you had no reason for not enrolling, and actually, even if you're not going to enroll, if you want to delay Medicare, you need to actually talk to the Social Security Administration and let them know that there's a reason why you're not going to accept the benefits of Medicare at age 65. And the only reason you do that is if you're going to work past 65 or your spouse is going to work past 65, and you're going to be covered by an employer group plan that will be your primary insurance. There are rules about sizes and so forth, which I'm not going to go into right now. But when you face those decisions, you need to be aware that every employer group plan does not necessarily give you the right to delay Medicare. So it's something that needs to be discussed with somebody. Everything we're talking about today, that we will talk about today, will be in one of two SHIIP brochures. The basic benefits of Medicare is in, we call it the SHIIP combo form, but this form, which is the basic SHIIP counseling form, explains all the benefits of Medicare and all the other programs involved with Medicare. The brochure that actually deals with enrolling in Medicare and what you need to do is the road to Medicare, planning your drive towards 65. This brochure covers everything that we're going to talk about today, as well as having on the back the phone numbers that you may need to talk to about Medicare. And one thing to understand about Medicare is there's two agencies really involved beyond SHIIP. SHIIP, we are a counseling agency. We help people understand it. But there are two administrative agencies involved. The Social Security Administration basically does two things for Medicare. They enroll you in it, and they make sure you pay for it. Other than that, they're more or less out of the picture. There's actually one other thing they can do. If you happen to lose your Medicare card, they can replace it. But they are really, and there's a reason for that. The Social Security Administration is the only physical presence of the federal government in the community. There's 1,300 Social Security offices across the country. If you want to walk into a federal office, that's about the only option you've got. So they are, and as with many things that come along, the Social Security Administration ends up being the face of the federal government. The benefits of Medicare, once you actually are in the Medicare program and are using the benefits, they are handled by the Centers for Medicare and Medicaid Services. Basically, it's called, whenever people refer to it, they just say Medicare because that's who they're calling. Phone number is 1-800-MEDICARE, and they handle the benefits of Medicare. They have nothing to do with enrolling you. They have nothing to do with paying for it. They handle the insurance benefit of the Medicare program. SHIIP, we are there to help people deal with wherever they fall within this picture. Whoever they're dealing with, if you don't understand it, that's what we're there for, to help them understand. Back to the enrollment process. Again, you have this initial 7-month window to enroll in Medicare. If you happen to miss that, and most people that miss it through either a misunderstanding or thinking they're going to beat the system by just waiting till they need services, your next opportunity to enroll in Medicare is the annual election period, which runs January through March of every year, with your benefits delayed till beginning July 1. So if you miss your initial enrollment period, it could be an extended period of time before you're able to enroll, and even a longer period until your benefits begin. So you could be without insurance for an extended period of time. And on top of that, there's a penalty involved, a financial penalty. If you enroll in Medicare late and you had no reason through employer group coverage to have delayed it, Medicare will assess you a penalty of 10% for every 12-month period that you did not have Medicare after you were eligible. And that penalty will apply for the rest of your life. So your Medicare premiums will be increased by 10% for each 12-month period. I've seen numbers as high as 60 or 70% with people that delayed Medicare because they decided it wasn't worth paying for. Well, you will pay for it. There is one exception to that penalty as far as it being a lifetime. If you incur that penalty as a disabled Medicare beneficiary, when you turn 65, they will take the penalty away. One of the things that Medicare does in their rules is people that join Medicare before 65, they kind of recalculate everything at age 65. Supplement plans are calculated that way. That penalty goes away. So that's, yes, Gina, we got a question. She's going to bring you a microphone.
I'll hold it. So when you say delay getting your Medicare, you're talking about B. Because,
B, right.
Right.
Yeah.
Or are you talking about just going down to Social Security and starting your A and having a conversation? I'm 65. My Social Security doesn't begin until I'm 66, but I'm turning 65. Wonder if you don't go down there and even talk about A.
Well, you wouldn't have A or B in place at that point. They can penalize you for A, which has no premium, although I am not aware of that ever happening. But what we're more or less talking about is delaying Part B, which is the part of Medicare that you pay for, and we will be discussing that shortly.